Jon, thanks for coming to talk to us this afternoon. It was great to hear you talk earlier this morning about genomics and the future of genomics within our healthcare industry and systems and the emerging technology around that. Do you want to explain a little bit more about, from the perspective of the health community, what you would like us to be considering?
Great, thanks Rebecca. What I'm really interested in is, as much as this is about technology, actually it's about people. So we're really interested in finding people that have an interest in genomics in New Zealand and trying to foster that conversation. So I kind of highlighted a number of areas which I think we need to start thinking about. So the standards around genomics from an operational perspective. So how do we store the data? How do we manage it? Some use cases. So what is it that might make New Zealand stand up and think, actually, this is a really good thing to invest in? So one of the questions I got asked was, is rheumatic fever something that might be useful, or is renal disease something we could investigate? As I said in my talk, Ireland's focus is on epilepsy in children, basically.
Absolutely. So we need to engage more in the genomics and the arena of genomics and how that's going to benefit our healthcare community here in New Zealand.
We do.
And I can see that you believe very much that we need to be careful around that too. There's some ethical considerations and some understanding around that. Explain a little bit more about these ethical considerations. Sure.
So the interesting story to me is there was a conversation on breakfast probably about 2 weeks ago. A chap with Huntington's disease decided to find out about Huntington's disease, find out whether he had it. We offered that genetic testing, but the question becomes, just because it's available, should we do it? Should we make everybody aware of what their potential, what the potential thing is that's going to kill them? In the context that obviously, genomics is only part of the picture. So as much as it's about your genome, it's actually about your lifestyle factors as well. So, are you drinking clean water, are you eating good food, and are you having enough exercise, are you living in a safe and warm house? So I think while it's really, really important and it has a lot of potential, we need to think about it in that broader public health context.
Okay. And you talked significantly around the reduction in cost it's likely to be in the future, the fact that it's going to be so much more accessible to our communities. How do you see that panning out in terms of both the uptake and engagement by our public and also the response then from healthcare?
Well, I think the interesting question is, when it's $100, what's stopping people using it? Interestingly enough, as we've seen the price of mobile phones come down, as we've seen the price of computers come down, as we've seen the relative cost of international flights come down, the usage has just gone up, and we've seen consequent change to culture and society as a result. So I don't think as a health system we can necessarily control access to something like this. The question is, how do we best harness what people are going to want to know about themselves, and how can we provide sound advice and support and benefit New Zealand Inc. as well. So I suppose one of the big conversations we're having in the Ministry of Health at the moment is the value of the information that we have as a country. We've got a long longitudinal record spanning back to the 1980s attached to an NHI number. How can we take advantage of that in the context of genomics? So how can we work out how genomics is playing a part and how the health system has been playing out for the last 30 years? New Zealand's actually in a very unique space for that, because it's something that many countries such as Ireland haven't had, and so they're not even, despite them rolling out an individual health identifier last year, they're a long way from building that complete record. And so if you know that a health record on the black market's worth $75 US and your Facebook data is worth $14, our health record's worth somewhere between those two things. And if we multiply that by 4.5 million every year, suddenly we've actually got a really interesting national asset. The question is, how do we both manage the data effectively, but how do we take advantage of that as a country as well?
Absolutely. So I can hear you're saying that, society are going to engage, they're going to take up on this. As a health community and as a health system, we need to be prepared. So we need to be engaged in genomics, and we need to be a far better understanding of how we're going to participate and engage in governance, that kind of thing.
Agree. I think the governance word's a really interesting thing, because I suppose a number of these conversations are going to lead us to a point where we're going to be in a situation where we're starting to gather this information. Something we're really interested in from the Ministry of Health perspective is that broader conversation around data governance. So is genomics just another type of data that we then have to manage? How do we manage that as a system? How do we provide access to researchers in an anonymous but aggregated way? How do we work with companies who see value in that as well? So Of course, what we don't want to do is destroy any social license or trust that the health system has, but at the same time, there is never enough money in healthcare. So if we have an opportunity to ask the public to participate in funding the system, this to me feels like a really opportune time. And it's not like we're alone. So what we know is that a number of countries are going down this line, most notably Japan and the US, and they have taken a very insurance-focused approach to this. But also Israel's made an announcement in the last month around a $260 million partnership with SAP to start to create that longitudinal record.
Wonderful. Great. Well, it sounds like there's lots of potential and we need to get started on that journey.
Yeah.
Thank you very much.
Feel free to join us on Yammer.
Will do. Thank you.
Thanks.